about the processing of the machines, why we have to take them from formaldehyde to paraffin. Because paraffin does not mix with liquids like water or alcohol. So if we want to manually embed or automatically embed the sample in paraffin, all the liquid has to be removed from the sample completely. So the first step is formaldehyde, because we have to make sure that the sample has been properly preserved, because the formaldehyde makes sure that the tissue does not rot, and that is also completely processed. Because if it's not completely, if it's still raw, there are certain staining processes that we cannot complete, because the staining will not fix to the tissue. So if we want to do like an immune histochemistry analysis, for example with some hormones for breast cancer, and if the breast tissue is not properly fixated in the formaldehyde, the hormone receptors will not stick to it, and therefore we cannot tell if it is a receptor for estrogen or anything else. So the first step is formaldehyde, to make sure that it's completely processed, and then we start gradually removing all the water from the tissue. So we start with the 70%, and then we go over to the 96%, and then 100%. And with the 100%, all water has been removed from the tissue. And when that is done, we go over to a chemical called tissue clear, which prepares the tissue for the paraffin part. And the paraffin step, or the paraffin embedding of the tissue, is the last step. And the reason why we use paraffin is because we embed the tissue in paraffin, and we also section them in paraffin. So now that the sample has been embedded, the technician is now sectioning the block. But the first thing that she has to do is make sure that she gets to the level where the tissue is by removing the excess paraffin that's on top. And also, since this is the one that's automatically embedded, you also have to cut off the plastic that surrounds the tissue. And then when she's done, she puts them on ice. And the reason why she does that is because when the wax is very cold, it's easier to section into very thin sections. Because when she is done, she has to put the tissue on a glass like this with the patient information here. This machine prints it out for us. The only thing we need to do is scan the block, and then it's printed out for us. And she has to put the sample on this glass, and the wax will automatically stick to the glass. And then when we're done, this is what one glass will look like. So here you have the tissue.
On the black background, that would be perfect.
So here we have the tissue on the glass, and the wax has been partially melted because we put it in warmth. And the reason why we also have to warm the slides up afterwards is to make sure that the tissue will stick to the glass. Because when we're done with this step, we then have to put them for staining. And the staining process can be a little bit harsh to the tissue, so it might fall off during the staining if we haven't heated it up properly. And when we when we're gonna stain them, we put them in these racks because that's what the machine uses. And the staining process is in here. And this is our main machine. This is where we do all the HE staining, which is hematoxylin staining. So it has a similar process to what it does in the processing machines. It has to start with some heat to make sure that the paraffin and the tissue sticks to the glass and melts to the glass. And then it goes into tissue clear. And the tissue clear removes the excess paraffin that's left on the glass. But the problem with tissue care is that it doesn't mix with water. So we have to remove it by putting it in 100% ethanol. And then we have to wash them back here. So here's one rat that's in the wadding. It's in the washing part. And then when that's done, that's when you can start the staining process. And the red liquid that you can see there, that's the eosin. And that makes sure that you can see the cytoplasma in the cell. While the blue one, for hematoxylin, that stains the nucleus of the cells. So that gives you a very good view of what the cell looks like and what the nucleus looks like. If it's compact or if it's bigger, what's the shape of it. And also here we have different baskets full of ethanol in either 70%, 96% and 100%. And the reason why we have that is because we use it for further differentiating and cleaning of the stains. Because we also want to remove the excess eosin or hematoxylin so it doesn't give any interfering. But we also want to make sure that the differentiation of the different nucleuses is as best as it can be. So when it's done all that, it goes into the last step, which is cleaning off all the excess water and the staining in 100% ethanol. And those are two steps, the two 100 ethanols. And the last step is silane. And silane is a chemical very similar to tissue care. And we use silane to put a protective plastic on top of the tissue. So this machine does it for us automatically. And then when it's done, the sample will look like this. So this is a glass that has been stained and the tissue has been covered by a piece of plastic. So now the doctor or the pathologist can microscope them and give a diagnosis of the sample. And this part is the last step before the slides go out to the pathologists. And in this part, we gather all our slides and we divide them into different groups like intestines, or skin, or gynecology samples, or urology, or sarcomas, and so on. Because the pathologists that we have, they have specialized in different types of tissue and organs. So we want to make sure that we give them the organs that they have specialized in. And that's what they do here. They add up all the sections that they get throughout the week, and they add them up to points to make sure that all the doctors get 24 points each. And here you can see the name of the doctors and what kind of group they belong to. And this is the last step. So now after that she has trimmed the block, she's now going to take the section of the cassette. And in this stage we're sectioning it on a 3.5 micromillimeter level, which means that you get one level with the nucleus and the cells. Because if it's too thick, you won't be able to see the nucleuses properly because they'll all be lumped together on several levels and it'll be difficult to differentiate them from one another. So now she's transferring it to a wet glass and making sure that there's no wrinkle in the tissue because we want to remove as much of the wrinkles as possible. And this is cold water.
This is actually the sample you did now, right?
Yeah. So now she's going to section the sample that we manually embedded.
was also an urgent
Yeah, an
sample. So
urgent
this is a
sample.
patient now at the hospital and
Yes.
actually...
And they need the answer quite urgently.
Yeah.
So when she's made sure that the sample or the section has no wrinkles on it, she puts it into this warm bath, which has 48 degrees Celsius, and she does it to stretch out the paraffin and also the tissue itself. And the reason why we do this is because we want to make sure that there's no wrinkle in the tissue, but also that the tissue and the paraffin will attach itself to the glass and keep firm, that it won't move around anywhere on the glass. And since this is a special sample, she also needs one glass with the HE staining, but she also needs to stain for iron and reticulin and the Masson trichome. And those are stains that we usually do for liver samples, if there's an unknown reason for why the patient is sick. If the patient, for example, has cancer in the liver, you usually just do a Alcian blue pass coloring, which will identify cells that produce mucus. So as she's getting the section, she just puts them in the warm bath before she picks them up with the glasses that she needs. And the ones that she doesn't want, she just discards them and throws them with the other wax that we're not going to use. So now that she has the number that she needs, she just picks them up with the glass. And now she's done.
There we are.
Okay, so now I'm going to show you how we take out the samples that we received. So this is the workstation that we have. It's a little bit messy at the moment because the doctor used it earlier. So first thing I need are gloves, because you don't want to touch the formaldehyde with your hands, because it is a possible cancerous chemical. And it could also give you a skin rash, and if you have like cuts on your fingers, it'll sting very much. So always wear gloves when you're working with formaldehyde.